Hello and welcome to Itenif Healthcare Solutions webinar, Deep Dive into NextGen Virtual Visits. My name is Chelsea Grover and I'm the Marketing Communications Manager for Itenif. Before we get started on today's webinar, I want to take a moment to explain the process for the presentation. First, I'd like to mention that this webinar will be recorded and that we'll send out a copy of the slides along with the recording within the next week. Next, I have some super exciting news to share with you all. Itenif is now part of DAS Health. DAS Health is a leading provider of health IT and management solutions and a trusted consultant to many physicians groups, hospitals, and healthcare systems across North America. By combining our skills and expertise, we'll be able to provide even more support, value, and solutions to your practice. We're looking forward to continuing to serve you. Next, I want to reassure you all that we are still here for you. As you know, we specialize specifically in NextGen healthcare, and that's not going to change. We're still going to continue to provide the unparalleled level of experience and expertise and compassion and care that you know and love and have come to expect from us. And we're still going to continue to offer all of our same offerings, but now more. And we're also still going to have ChartGuard, Refund Manager, Unapplied Deposit Manager, Multiple Encounter Billing Manager for NextGen. Next, I wanted to share an upcoming webinar with you. On December 8th, we're going to help you learn everything you need to know for an audit. So keep your eyes out for an invitation to that on LinkedIn and via email. Okay, so back to today's webinar on a deep dive into NextGen Virtual Visits. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Lexi DeMarche is Manager of Consultant Development and Holland Lively is a consultant at Itenif. So with that, Lexi, I'm going to hand it off to you. Feel free to get started.
All right, thank you, Chelsea. Hi, everyone. Thank you for joining us today for our webinar as we go into a deep dive of the NextGen Virtual Visits platform. So as we all know that, the patient-clinician relationship is kind of ever evolving. Our current healthcare environment, it's really important that you kind of take a step back and look at, maybe some new opportunities of how you can provide that clinical support that you've been providing for your patients. So we know that, patients are sometimes difficult to get into the office. Might be due to transportation or their health. So we kind of want to look to see why so many providers are turning to telemedicine. So we're going to provide you some insights today, on how to integrate telemedicine, more specifically the virtual visits platform, into your current workflow, and then how you can gain that physician buy-in. So as we know, bottom line, there are those who are struggling with health issues that are struggling to get the care that they need. So this virtual visits platform may be, a way to provide that for your patients. So specifically on today's agenda, we're going to start by kind of just looking at a quick overview of telemedicine. So I know this is something that's probably not new to a lot of you, but we just kind of want to make sure that you understand, kind of the main drivers for use of telemedicine, and then, kind of the ways that your practice can use it. We're also going to look at the virtual visit setup within NextGen and what using that virtual visits platform is going to look like for your clinical staff and your providers. We'll also touch on a few virtual visit enhancements that we will see with the spring release, so that 6/2020.1 version of NextGen. And then finally talk a little bit about how you can gain that provider and patient buy-in to really make this successful in your practice. So as I mentioned, before we really deep dive into the NextGen virtual visit platform, let's first take a look at what telemedicine is. You may already be familiar with this concept. This has kind of been a hot topic for, definitely in the past 2 years, but I did just want to give a brief overview so we're kind of all on the same page. So what is telemedicine? So telemedicine is the delivery of clinical healthcare services. So from one site, so typically, if the provider is in the office or even from their own home, via electronic communications to that patient to kind of help improve that patient's clinical health status. So really, this is a growing market. This is really the future of healthcare. It's fairly easy to adopt. There's a lot of ways that you can use this application, so things through two-way video, smartphones, different wireless tools to really help improve your patient engagement and create a greater demand for the service within your patient population. So there are several elements of telemedicine that I want to review. At the most basic level, the purpose of telemedicine, like I said, really to provide that clinical support, and it can overcome things like geographical barriers, connecting users who are not in the same physical location. It also uses various types of communication technology, so it can kind of offer different options for your patients of how they can connect to your providers. Short of actually physically going into an office. And then really, all of this, the goal is to improve health outcomes, especially, for some of those patients that are kind of marginalized. So, maybe in more rural areas or, don't have the, capability of getting to an office. So I just kind of want to quickly review some of the different modalities, just so you know some of the terminology when it comes to telemedicine. So there are kind of different types of communication methods that can be used to facilitate that visit. So the first is live video. So that's going to be a live, two-way interaction between the patient and the provider. So this is the type that we're probably most familiar with, what we think of when we think of telemedicine. So, outside of using NextGen's platform, which we're going to review here in a little bit, this has also, can be accomplished through things like Skype or Zoom, FaceTime, things like that. Next, we also have an option called store and forward. So this is more of a transmission of a recorded health history to a provider. And so then they use that information outside of a live interaction with the patient. So an example here could be a group sending an X-ray electronically to a radiologist to review on behalf of the patient. We also have remote patient monitoring. So this is another kind of hot topic that we're seeing become a lot more popular when it comes to telemedicine. So if you're not familiar, remote patient monitoring is basically using personal health data that's actually collected by the individual and then is transmitted to the provider. Like an example of this could be a patient who uses their Apple Watch to track, their blood pressure or, heart rate, or, maybe uses a Fitbit to track, steps, or even, a device to track patient's insulin, things like that. So it's actually collected by the patient and then transmitted to the provider. And then lastly, there's a category called mobile health. And this is basically just, healthcare that's tracked from mobile devices, so cell phones, tablets, or the patient's computer. And these can all track that information and then be given to the provider to be able to, go through and kind of sift through that information. So really all of these methods are starting to increase in popularity and usage. So you can kind of use a combination of all of these to, make sure that you have the data that you need and to be able to communicate with your patients. So I included this graphic from HIMSS. So not going to review this whole thing. This is really just for when we send out the slide deck, which we always do at the end of our presentations. That basically just gives you those items that I was just discussing. It kind of explains what they are and some examples of usage. So basically this can be used to kind of help you decide how you are going to use the different modalities of telemedicine in your practice. So with all of those options that we just reviewed, we're really finding, like I said, in the industry, that telemedicine is becoming more and more valuable. So, it's really going to change healthcare delivery as we know it. This is really, as transformative as, Uber was to the transportation industry. Kind of just changing that traditional doctor's visit into something that's, going to be more convenient for the patient and hopefully for the patient and at the practice end less costly. So there are a couple groups that are kind of recognizing this, and they're actually going to even be incentivizing groups for using telemedicine. So one of the first initiatives is what's called the quadruple aim. This was previously called the triple aim. And basically this quadruple aim, it's 4 main goals. It's improving the patient experience. So, things like quality, satisfaction, and the new goal of improving the provider experience, improving the health of populations, and then reducing the per capita cost of healthcare. So telemedicine really has the potential to help with each of these goals. In addition, we also have with MACRA, there are some new changes with things like telemedicine, remote patient monitoring, and these are now being recognized in the clinical practice improvement activities. And that's one of the 4 performance categories that physicians are required to report on. So this can be used to help with meeting some of those goals. And then another huge show of support we're seeing with telemedicine is from the American Medical Association. So they actually have approved a policy to include formalized training in telemedicine for current and future medical students and residents. So it really is emphasizing that this is something that is here to stay. So to make sure that our provider staff are equipped and know how to use this technology. And then more recently, in January, the Ensuring Telehealth Expansion Act of 2021 was introduced. And that bill will make permanent several telehealth changes that were authorized during that public health emergency related to the COVID-19 virus. So particularly, this is going to affect things like Medicare coverage of telehealth services. So it's really clear. You can see that a lot of organizations are kind of getting on board and understand the importance of telehealth. Okay, so with that little bit of knowledge on telemedicine and what it kind of looks like in the industry, I did just kind of want to point out some of the values of using telemedicine in your practice. So some of these might be obvious things that you've already thought of, and some of these you may not have even considered. So a big goal of every organization that we work with is increased patient satisfaction as well as increased physician satisfaction. Also, the ability to decrease costs. The cost of travel for patients, the cost of a practice when patients miss appointments. That's obviously something a lot of practices struggle with, so that can hopefully decrease if it's easier for patients to join that visit. Increased patient accountability, so kind of include that patient in their care, the ability to remotely send data or submit forms, things like that. They kind of have the ability to participate in making sure you have all the information you need to really make good, clinical decisions. Increased access to care. So obviously, extended reach, the ability to, reach a patient who maybe is, like I said earlier, in more of a rural area or doesn't have the ability to travel to a practice. They have the ability to still get, that excellent care that your practice can provide without, having to actually travel to that location. And then, the ultimate goal of all of this is improved clinical outcomes. So really, having that coordinated care, so the ability to include multiple, people within a visit, so different clinicians that maybe aren't physically located in the same location, as well as timely access to care. So potentially, removing the barrier of, having to get to the location or availability of a certain provider to a certain location, things like that. Those are all kind of some of the things that your practice could see with the adoption of telemedicine. All right, so now that we've kind of had a brief overview of everything that is telemedicine, let's take a look at what NextGen has to offer as far as virtual visits go. So we're going to kind of take a look at what the platform looks like, as well as some configuration that needs to take place, and then kind of some workflow recommendations for how you can make this work for your practice. So what exactly is this platform? So we kind of talked about the different options for our modalities for telemedicine. So NextGen Virtual Visits platform, it's a form of telehealth that utilizes two-way audio and video connection between the provider and the patient. So this platform is integrated with a solution called AutoHealth. So if you're not familiar, NextGen, I'm going to say recently, but now it's probably been about 2 years, acquired AutoHealth. And so now it's fully integrated with NextGen. And this platform, it provides a HIPAA compliant, secure HD video, and we'll see a lot of the other benefits of using this platform as opposed to just using FaceTime or Zoom. There's a lot more functionality that's included with this platform. So you may be asking yourself, what are some of the scenarios where virtual visits might be useful? So you may have thought of some of these already, but maybe there's some additional ways you haven't thought of yet. So one that we have seen a really huge increase in with the pandemic is screening potential for contagious patients. So you have the ability to maybe use that virtual visit to kind of meet with the patient before having that potentially contagious patient come into your office. So that's one of the ways that we have seen this platform used. Follow-up appointments. So, maybe it's something where you're just doing quick follow-up, want to check in with the patient, instead of having them come to the office for a potentially short visit, you could do that virtually. Medication reviews, refills, renewals. So if, you'd like to talk with the patient, maybe explain to them about a medication or discuss, if they're having side effects, or if you really just need to discuss, the fact if a renewal or a refill is appropriate. That's a great way to do just kind of a shorter visit through virtual visits. Review of lab or imaging results. So again, something that potentially could be quick and done over virtual visits. Surgical consultations, some after hours care. So, instead of having to have the office open late with, full staff, it might, be possible to have that after hours visit with just, maybe some clinical staff and a provider available. And then finally, chronic care management. So things that, typically require a lot of repeat visits, and it might be, difficult for the patient to fit that into their schedule. It might be hard for them to continuously come to the office. So that might be something you can incorporate into your virtual visit platform. Okay, so there are a few technical requirements in order to use the NextGen Virtual Visits platform. So none of these are really too difficult to achieve, but just want to make it known. So the first is that in order to be on NextGen Virtual Visits platform, you do have to have NextGen version 5984 or higher. So that is the minimum version in order to use this platform. In addition, there is a NextGen Enterprise API that does need to be installed. So if this is something that you don't currently already have in your system, you can open a ticket with NextGen, and they will actually go ahead and help you install that API and help you with the testing of that as well. And then finally, just as a note, we'll see in a bit that virtual visits can really be used with a lot of different, computer, tablet, cell phone. But I do want to point out that the compatible browsers for virtual visits are Google Chrome, Firefox, Safari, and I see that we missed one on this list, so I'll update that before we send these out, but also Microsoft Edge, which is kind of the latest browser. So that being said, really the main one that seems to give problems as far as virtual visit platforms go is Internet Explorer. So it's not listed as a compatible browser. So from both the provider's end to join the visit, as well as the patient's end, it might be a good idea just to kind of, make sure that they're using a browser other than Internet Explorer, just to avoid any kind of issues. Okay, so kind of circling back to the one point I made about needing the API. So I noticed it's kind of the term API has been, I feel like, thrown around a lot lately. But if you're not familiar, basically, what does an API do? How does it work? Basically, the API just allows you a way to connect the virtual visits platform to everything it needs to connect to. So in NextGen, that would be, our EHR application, practice management application, NextGen Mobile if you use that functionality, as well as the patient portal. So this would be either the legacy NextMD portal, or if you've upgraded to the PXP portal. For both of those, this API basically just allows that, kind of connection of all those parts. So really it's just to kind of streamline that user experience and trying to give one source of truth. So NextGen will really have all of that patient data without having to duplicate, entering that information. So the API really just allows you to easily connect with your patients virtually and hopefully provide a consistent experience as what they would have received if they would have come into the office. Okay, so once we have everything set up as we should, this is kind of the general workflow of how the NextGen Virtual Visits is integrated into your other applications. So it really is truly integrated. That's kind of the benefit of using NextGen's product. So the first is that scheduled visit is actually scheduled in practice management, and that's going to flow into the NextGen Virtual Visits platform. So the process to schedule that visit would, pretty much the workflow is going to be the same for, whatever staff you have to schedule visits. So they don't really need to learn, a whole new workflow. They can schedule that directly in the appointment book in practice management. The NextGen Virtual Visit platform does send a visit reminder link to the patient's email address, and that is also documented in NextGen. So you are able to see the ability that the patient has received that invitation, and then the patient will join the visit via that link, and then the provider will also log into the Virtual Visits platform. So either into the virtual visit portal or into the EHR itself and conduct that virtual visit. One thing I did want to note about the patient's end of joining is that it is login-less. So the patient does not need to create an account. They don't need to have a password. They don't need to worry about any of that. Basically, for them receiving that link, once they click on it, it will take them right into the session. So that is kind of a nice feature, is you don't have to worry about, last minute patients trying to log in, they can't remember their password, things like that. On the provider end, whether they are logging into the platform, they would need to log into that, or they would log into NextGen per usual to get into the visit. And then finally, all of that kind of basic visit information that is captured during the virtual visit prior to the patient joining is automatically sent back into the NextGen EHR application. And then all of the providers or clinical staff documentation would be completed in the EHR like they would any other visit, as well as any billing is finalized in the EHR as well. So really the virtual visits platform, kind of what we're trying to get at, is it's a way to integrate and allow you to connect to that patient, but the workflows to actually document the visit or complete the billing, those really are similar to what an in-office visit would look like. So in my opinion, I think it's a great way to kind of ease the transition, on your clinical and provider staff. Okay, so there are a few steps that your practice would want to consider when getting ready to use virtual visits. So I do want to point out that a lot of these steps are the same if you are currently using virtual visits and just not using the integrated version. So, if maybe currently you're just doing, telephonic, medicine visits, or you're potentially using, televideo, just not through NextGen, you may have already completed this step. But if this is kind of a new initiative that your practice is considering, I did want to review and just let you know some steps that we recommend for configuration. So the first thing to consider is the addition of telehealth locations. So kind of the main reason for selecting this, obviously for reporting purposes, then you can report, whether the patient was actually physically in the office or, it was telehealth. And then the other big thing is as far as billing goes. So as you may already be aware, a lot of payers do require that place of service to be used for telehealth visits. So basically, you would set up a separate location and make sure that you have that place of service to indicated. And then that will, when that billing goes out, it will go in place of that normal, place of service 11 code that we typically see for office visits. And then in addition, kind of the third reason for setting this up is for scheduling purposes. So you do want to make sure that on this location tab of the location master file that you are checking off that display and scheduling option. So this is going to allow your users to then go ahead and schedule those virtual visits. Another step in the configuration that your practice would want to consider when using telemedicine is telehealth specific event types. So basically we would create these like we would any other event type. So we could do this in Scheduling Administrator under that Events tab, and then we'd select Create New Event. So these telehealth specific event types will actually drive for what visits will be sent over to the NextGen Virtual Visit platform automatically. So you would want to make these unique from your typical visits. The naming of these, you could have different options to help you with identifying when you're scheduling or even running reports, things like that. But you go ahead and set these up and set up with all the different requirements that we would for a normal event type. So our event name, our short description, so again, those would display on our appointment book, just like we would see with any other visit. And then you would also want to then after this go to the Categories tab and make sure to add these event types to any applicable categories. So again, depending on your practice, you may add these into your normal day, or you may set aside specific times of the day when patients will be able to utilize the telehealth feature. So you can set that up under different categories as needed. In addition, you will want to review your SIM codes and look to see for your particular payers kind of what, how these SIM codes need to be configured. So, there are a lot of payers, for example, like the Medicare and Medicaid payers that will require specific SIM codes to be used when you are submitting claims involving any kind of, virtual care. For example, it might require certain modifiers such as the 95 or the GT modifier, as well as like we mentioned before that place of service of 2. So to set up these codes, you would do this just like any other SIM code. So here in our service item library, and you would want to make sure that you modify that description in a way that would allow the provider to select the correct code when they are on that finalized template. So you do, as a note, have the ability to also set up that modality and department. Like for example, there is a department of telehealth that can be added. And again, that's optional, but would just allow you to, for reporting purposes, be able to track your billing for telehealth separately from, your normal in-office visits. And then finally, we also have the ability to set up our SIM code categories. So this would be set up just like any of our other categories in our system master files, that service category master file. So this would allow you to set up a specific telehealth category of SIM codes. And then the provider can use these throughout in their EHR documentation. Like for example, these can be used on the finalized template. So that way you are, only showing them the codes that would really apply for that specific, telehealth visit. So you can there's an existing telephone/online category, or you can create your own, as many different categories as you need, just depending on your practice in kind of your workflow. So with that being said, that's really the configuration that we would need in file maintenance and in scheduling administrator to make sure that you have all the back-end work set up in order to use a virtual visit platform. So now let's move on to look at the actual workflow of the virtual visits and kind of how it integrates into NextGen. So here on this slide, we kind of have two graphics that we borrowed from NextGen, and these are from the patient side as well as the provider side that kind of explains the typical workflow. So we can see on the patient side that basically the visit is scheduled. The patient would go ahead and open that appointment confirmation. And I'm just now noticing that patient and provider, we actually have switched on here. So we will fix that on the slides. I apologize. On the left-hand side is actually going to be the provider's workflow, and the right-hand side is going to be the patient. So apologize for that. So the visit is scheduled, like I was saying, in NextGen, and that will flow into Auto, which is NextGen's virtual visit platform. The patient would receive that appointment confirmation email, and they also include a device and connections guide and the ability to test your device prior to the appointment. So definitely recommend that the patient does that so they can ensure that they have the correct setup for that visit. The patient would then join that visit, either via email or text, depending on how they received that information, and they would go ahead and select Join Visit. Basically what that does is then that's going to change the status of the appointment in NextGen to kept, so the provider would know that the patient is logged onto the visit. The provider would then join either by going into the virtual visit portal, so that's at connect.autohealth.com, or they could also join by actually logging into the EHR. The patient would be able to complete any intake questions or consent forms that you have configured for your practice. So that would just, get some basic information from the patient prior, and then also, obviously any of those consents that are needed that you would typically collect, if they were physically in the office. The virtual visit would be conducted, so, the kind of typical conversation that would go through with a visit with the patient. And then finally, like I said, all that billing and documentation would actually be done in the NextGen application. So that piece of things would stay the same. Okay, so as I mentioned before, with this application, being fully integrated, all of the scheduling is done in the enterprise practice management application. As we discussed before, it is recommended to designate those specific virtual visit event types. So that will allow not only your staff to be able to see that is in fact a virtual visit, and not to expect that patient to come walking into your waiting room, as well as that is what is going to be set up to prompt the visit to be sent over to the NextGen Virtual Visits platform. So you want to make sure that those are set up for your practice. The virtual visit platform will also send automatic reminders to the patient, so they'll get that initial appointment confirmation, letting them know when that appointment is scheduled, as well as a reminder either email or text, just depending on the information you have for the patient as well as your practice settings. So these communications are really customizable. So again, like I said, either text or email. You can also customize the timing of when those reminders will go out to the patient. You can really customize the content of the email. So again, you might want to add some additional details, maybe a link to your practice website, things like that. You can modify the header color of the email. So a lot of times practices will kind of have that match up with their logo, kind of the color scheme that you use. And then finally, the actual logo itself can be within that email. So that way your patients do recognize, this is coming from your practice, and so they're not confused, where this email is coming from. So we do recommend, just a tip for, if you're going to start using this platform, and this is something you can even do today, and that is to verify your patient's cell phone numbers and email addresses. So this is really important, to make sure that the scheduling the virtual visit is received. The appointment confirmation is received, those reminders. So that's something that you want to make sure is up to date, so the patients have the information they need when they're ready to join that visit. So prior to joining the visit, the patient will be prompted to read an electronically signed and informed consent, a privacy policy, as well as a patient user agreement. So these electronic signatures are go on these consents, and then they'll be available to your practice if you did need to go in and review those. We also had the ability to configure some pre-visit requirements, such as an intake form, maybe a place to document things like any demographic changes, maybe some histories, things like that. So you can actually go in and set these up for the patient to complete before the visit. So that way your provider has the ability to go ahead and review this information before joining with the patient. And there is also, as a note, a customizable window of time that the practice can allow the patient to join that virtual visit. So typically the kind of default is to set that for a 10-minute window. And then that way the patient doesn't join the visit too early and is sitting there waiting, as well as doesn't join the visit too late after the provider has already logged off. So you do have some customizations, and that all can be done during your implementation of this platform. So once the patient actually joins that virtual visit, that appointment status is going to be changed to kept. So this would be seen just like we see now, in the EHR and the PM application. So that way the provider knows that they can go ahead and join the virtual visit, as well as on the practice management side, if you do have any support staff that is going to be joining the visit as well, they can see that the patient has joined. So once the patient has joined, the provider can then either log onto that virtual visits website, or even from within the EHR, click that join visit link, as well as there is also that view intake button, and that will show them that information that was collected prior to the patient joining. So they do have the ability to review those pre-visit screening questions and demographic information. One little tip is to make sure that on whatever device the provider is using, that they allow AutoHealth.com access to their microphone and camera. So that is going to allow the provider to actually communicate with the patient. So you want to make sure, along with any kind of firewalls or anything like that, that is not being blocked. Otherwise, there could be issues with joining the visit. Hey, so then there is some steps, along with conducting that visit. So the first that I want to point out is that only one patient is allowed on the virtual visit at a time. So we will see in a few slides that there were some enhancements with the spring release that do allow guests on virtual visits. But I did want to point out at this time that group visits are not supported with the virtual visit platform. But that is something that NextGen has mentioned is on the roadmap. So if that's something your practice is considering as kind of a use case for this, that'll be something to look forward to in the future. They're also allowed up to 2 staff on the virtual visit. So that would be what referred to as a scheduled user, as well as a support user. So the scheduled user, that is the user with the license that indicates basically they have the ability to have their own schedule within NextGen virtual visits. So typically that's going to be the provider, if that's going to actually be performing the visit. In addition, you can have a support user. So that is for our support or administrative staff. So, you can see examples like a scribe, maybe someone at the front desk who's scheduling a follow-up, basically any other staff besides that provider that potentially could need to join that visit alongside the provider. So as I mentioned, you do have the ability to add a guest to a virtual visit. So this is done, by the patient. So they can do this before they join the virtual visit. In their confirmation email, there will be an invite a guest button. So they can go ahead and click that, and then that would allow someone else to join the visit alongside them. They also have the ability during that visit to invite a guest. So again, while they're already in the visit, at the bottom, there'll be an invite a guest icon. they can click that. It would then prompt them to enter the information, so the first name, last name, as well as the email address of the person that they are inviting. So any guest must be approved by the patient before they can join the visit. So, this is typically used for cases, where it's maybe a caretaker needs to join, maybe it's an elderly patient, so one of their children, or, a child with a parent. You can kind of think of different use cases for why this would be used, but, the patient ultimately has the approval, and there is ultimately the ability to remove a guest at any point during the visit. So you can go to the guest management page and remove them if needed. So during the actual virtual visit, along the bottom of the screen, the patient and the provider will see several icons. So from the provider's point of view, this is where a provider could add things like interpreter services if your group uses those. They can view the chat function, so the ability to chat back and forth between the patient and the provider. The ability to share their screen, so if they had something up on their screen they wanted to share a document for the patient. The ability to turn on and off things like the camera and the audio. And then there also is a timer for the visit. This timer is only seen from the provider's point of view. So it's just to give them kind of the ability to keep track of how long they've been on this virtual visit. So I mentioned this kind of earlier, but the ability to use support users alongside your provider is an option in the NextGen Virtual Visit platform. And so these are kind of some of the different ways that support user can be used. So first is that support user is actually have the ability to start the visit. So before that scheduled provider, to do things like collect patient information, update demographics, kind of those registration steps that would typically take place if this visit was happening in the office. Support users can also join after the scheduled provider. So things like, those end of visit kind of wrap up that checkout process, collecting payments, things like that, as well as alongside the scheduled provider. So things like if your organization utilizes scribes, so they need to be there during the whole visit, or even live interpreter services as needed. So basically, the platform does integrate with several different interpretive services. So you can add multiple vendors that you contract with. So for example, like LanguageLine is a pretty common one. And so once the visit has been started, the provider can go in and they can select that interpreter service. And just as a note, that interpreter would be joining just telephonically. So they wouldn't have the video aspect, but they would have the telephone capability to join in and be able to provide those interpretive services on behalf of the patient. There are also several third-party integrations. So you can really take this virtual visit platform and include even more aspects of your practice. So for example, from the intake point of view, if your practice is utilizing Phreesia, you can include that within your virtual visit platform. You also have the ability to integrate instant medical history. So if you are using that IMH platform for forms to collect discrete information, you can include that in your virtual visits. There is also the ability to collect payments. So those payments can be through partnerships with TSIS, Instamed, and then those payments would be processed in practice management, just like any other payment you would be collecting during a visit. And then finally, as I mentioned, those interpretive services. So LanguageLine is currently the only one that has a full partnership with NextGen, but you do have the ability to integrate other interpretive services telephonically into that visit as needed. And then after that virtual visit has ended, that basic information is sent back into the patient's chart. So you will see the encounter for that visit and then any documentation. So you can see the intake form, you can see the documentation that the provider or the scribe was collecting during the visit, as well as any information or documents that were sent back and forth between the provider and the patient. So really all that documentation still takes place in the NextGen EHR application. Okay, and then finally, the billing for our virtual visits will also still remain within NextGen. So any of that billing that takes place on the finalized template by providers will still happen for virtual visits. And then that will flow over into the PM application. There will be certain changes, so things like that place of service code being different, maybe different modifiers that are needed, but the workflow will pretty much stay the same. We do just want to point out that, as always, consult with your billing and compliance staff to kind of identify any specifics that will be needed, depending on your state and the payers you contract with, things like that, just to make sure that you are compliant as far as the billing goes. So now I'm going to turn it over to Holland, and she's going to walk you through some of the updates that you will find with the Virtual Visits platform in the 6.2021.1 spring release.
Great, thank you, Lexi. So now that you guys have a general idea of the flow of a virtual visit within NextGen, I wanted to point out for those of you who are currently upgrading or maybe planning to upgrade to the spring release or the 6.2021.1 version, there are a few enhancements that you will see when you're using that virtual visits platform. So the first new virtual visits feature is the ability to schedule on-demand virtual visits without having to leave the EHR. So instead of having to go into the PM application or that separate website going into the virtual visits platform, you can open the file menu in the EHR and select new and then schedule on-demand NextGen virtual visit. That's going to open that virtual visit website to schedule the appointment, and that's what is going to send that link to the patient. So this is going to be just like if the visit was scheduled on the virtual visit website or in PM, and it's going to be added to the appointment book, so it'll be tracked and reported on the PM side as well. So this feature is going to be ready to be used without any configuration, but there is a preference added in System Admin under Universal Preferences, and it's going to be defaulted with the URL for AutoHealth, so it's not going to require any setup before the feature can be used. Another great virtual visit feature that's going to come with the upgrade to spring release is the ability for the provider to join the virtual visit directly in the EHR application. So instead of having to find the link or go to a separate website to find to the new virtual visit, the icon will be added there in the patient information bar for them to select and access the virtual visit that way. Once the patient's checked in for their visit, that video camera icon will show join virtual visit when it's hovered over. So the provider or other user that might typically start the visit can then click on the icon and join that visit. One thing I do want to point out about using that icon is if a provider is remoted in to access the NextGen application, such as like maybe using an RDP, you might have trouble connecting directly to the attached virtual visit link. So in that case, all hope is not lost. The provider can still access the link in the EHR by right-clicking on the icon and selecting copy link. And then they would paste that link into a web browser, and then they would be good to go. It is a few more steps, but it still saves time searching for the link. In the spring release, we'll also see several enhancements to the virtual visits documentation and billing functionality within the EHR. And the first edition is the addition of 2 new visit types. So you'll see virtual visit telephone and virtual visit video. Those are going to be available by default for all specialties. There is also a new system practice template for virtual visit payer configuration. The template is going to allow practice to configure all of the payer-specific requirements for virtual visit billing. For example, if a payer requires a specific place of service code or modifier to be used, many practices have already created custom SIM codes to account for these billing requirements, so you can continue to use those. But this template, I did want to point out that the practices don't need to use both. So finally, the finalized template has been modified to include a new virtual visit billing panel. The panel will automatically be enabled and expanded when either of those two new virtual visit types are used on an encounter. There is the ability to capture different types of time spent, such as face-to-face or non-face-to-face, as well as start and stop time entries that are going to be used to calculate total time. You can see there are also blue links to billing resources located on the template for easy access to things such as guidelines and fact sheets. So lastly, we've gathered some tips and tricks that we've learned along the way that might help your practice with the implementation of virtual visits. So providers can change their profile settings in the Auto website or the virtual visits platform that can include things such as a profile picture or any sort of customizations like that. And we mentioned earlier, if the connection is used with an RDP, you're going to want to make sure that you launch virtual visits outside of that RDP so that the device is able to connect to the microphone and camera on your device. Along with that, make sure that you're testing your device before conducting or joining a virtual visit to avoid any sort of technological hiccups. And also making sure you're using the correct event types and resources when selecting and scheduling that appointment. Also, verifying patient demographic information will ensure kind of a seamless adoption with that. So making sure you have the correct email and cell phone number on file would be a good place to start if your practice plans on implementing virtual visits. So as you can see, there's a lot of great functionality that your practice can take advantage of in the virtual visits platform to help your clinical staff and providers offer the same great care your patients have come to expect, but within the comfort of their own home, car, or wherever they choose. So you may be asking yourself, how can we take a visit out of the traditional brick and mortar setting to online? And more specifically, how can our practice transition to use virtual visits? Well, we would love to help you answer all of these questions and any others that you may have. So if you're wondering what your next step should be, or you're interested at all or want to learn more about us, you can visit us at itentive.com. You can sign up for our informative webinars and blogs that we house. We also have 3-day fixed price on-site consultations for clinical workflow, rev cycle and front office, as well as technology and performance. And you also can test drive our products. So lastly, we have time for questions. Our contact information is up on the screen. So if you have to jump off and you want to email us a question if you'd like to learn more about us or the content that we covered today, please feel free. I'm going to turn it over to Chelsea now, who's going to go over the questions that were asked and put in the chat. But before I do, I really want to say thank you for staying on. So with that, Chelsea, feel free to start with questions.
Great, thank you so much, Holland. And again, Lexi, thank you for starting, and thank you everybody for joining us today. So we're going to go through the questions in the order that we've received them. We have a handful, so if you're sitting on any, feel free to ask them. We still got plenty of time. We should be able to answer them all. Okay, so first question, does it have an integrated interpreter? Lexi, I think you're muted.
Okay, yeah, I can take this one. So yes, as of now, really the integrated interpreter is language line, which is a fairly common one. But there is some options to integrate other services. So that would be a great question if you have a specific interpretive service that you would like to integrate during your the process of implementing. But yes, there are definitely options with that. I will say one of the requests that we've gotten a handful of times, which I know affects some practices, is the fact that currently, the interpretive service is really telephonic, meaning, just telephone, there's no video. So if your practice does currently utilize any ASL interpreters, we understand that is definitely, that can be, a potential hurdle. So currently, I know that is an idea out on the success community. So if you'd like to go ahead and, upvote that idea, something potentially down the line, or there's also options to add that ASL interpreter as a guest to the virtual visit as well. I know it's something that has been discussed, but currently there's no option for the video aspect for things like ASL.
Okay, great, thanks. Next question. Is there a way to have a survey after the visit concludes for the patient to complete?
Oh, I don't know if we lost Holland. So there are ways to have surveys go out automatically after visits. There are some additional platforms that you can integrate. So that's something, yeah, you could definitely look into including into your virtual visits as well as just your in-person visits as well.
Can an MA do an intake prior to the provider talking with the patient, not on the visit at the same time?
I can take that one. I think I was muted. I'm having some audio issues today, so thank you, Lexi. So yes, an MA could do an intake prior to the provider. That would be in the form of a support user that we covered earlier, so they can come in and do like collecting that patient information, updating the demographics. They also can, again, come in after the provider as well, so they can collect the payment, or maybe perhaps alongside the scheduled provider, so doing that scribe servicing, or if you needed some sort of live interpreter, those could be there as well. Again, so those would be your support users that would be utilized within your virtual visits.
Great. Speaking of support users, looks like we have another question on them. Can a support user end the visit? We'd like to utilize a workflow where the support user intakes the visit and completes the intake. Then when the provider is done with the patient, have the support user rejoin and then complete the visit so the provider can move on to their next patient.
Yeah, so I can go ahead and take that. So yes, the support user could definitely start or end the visit as needed. And I would say that's a pretty common workflow to, like you said, allow that provider to kind of do their piece and then jump off and join another visit. So yes.
Okay, another question. Are you guys taking over for NextGen Virtual Visits?
If you mean Holland and I, yes, no. No, I think if I understand you correctly. So yeah, so basically what I was kind of talking about, if you aren't familiar, essentially NextGen acquired Auto, and again, if I believe I'm correct in saying it was about 2 years ago, could have been a little bit before that, and basically so the Auto product is now just rebranded as NextGen Virtual Visits. But it's the same platform. It uses that Auto platform to function. But yeah, it's a NextGen product which benefits NextGen users to again have kind of more of that integration, and it's really compatible. So yeah, hopefully that answered your question.
Perfect. And Lexi, can I ask you to touch on a couple of the comments that Carissa sent throughout the webinar?
Sure. So yeah, Chris, yeah, thank you for your comments, definitely to make sure it's clear for everyone. So one of the comments was device testing is only available through email and not text invite. And yes, you're definitely correct on that. So that would be something to just keep in mind when you are deciding how to send out those appointment confirmations and reminders. If a patient would like to go through and test their device ahead of time. And then Chris also made a great point about the fact that a patient can join the visit early and start their paperwork and make sure their device is working, all that kind of stuff. So definitely would recommend them do that ahead of time, so that's something you can communicate. And she pointed out though that you can't leave the browser while once you've joined. The patient can't. So she points out no browsing other sites while waiting. Yeah, that's definitely a great tip. So if patients are having issues with that, if they do plan to join early, that could be a good piece of advice to make sure that that's not what's happening.
Okay, perfect. Looks like we have another question. Does the kept status create the encounter as well, or does the check-in out auto flow process still need to take place by the staff?
So yeah, that's a great question. It does not actually create the encounter or any of those check-in process that you typically would do. So things like, attaching insurances, if you're verifying, privacy policy, things like that. Whatever steps you typically take. So that would still need to take place, as well as if there is a checkout like AutoFlow that your practice currently uses, and you want to, continue with that with your virtual visits, you would want to incorporate that into your workflow. So yeah, that's a great question.
Okay, perfect. Well, it looks like that's all the questions that we have. If you think of any questions or you didn't have a chance to ask them, you see both Lexi and Helen's information up on the screen. Please feel free to reach out to them directly. Otherwise, you can always reply back to the email that I'll be sending that has a link to the recording and the slides. Basically, any way you can get a hold of us, we're happy to help. That's why we're here. That's why we do what we do. And as we're transitioning to be known as DAS Health now, keep in mind, we're still here for you. We're still going to keep doing these webinars. We're still going to keep answering your questions. So please, any questions you have at all, feel free to reach out to us and we're happy to help.
All right, thank you, everyone.
Yes, thank you, everyone.